Vermont healthcare regulators have made their judgments on how much hospitals can spend and charge in the coming year. The 5-member Green Mountain Care Board goes through this process every year. It's required by law. It's complex, sure, thick with numbers, and this year, relatively high healthcare inflation playing a central role. In the end, they said they tried to balance affordability with the need for hospitals to remain financially viable. Vermonters spend over $6 billion on healthcare each year. Hospitals get a lot of that. UVM Medical Center in Burlington asked the board to approve nearly $2 billion in spending, for example. We'll hear from both sides this morning, starting with Green Mountain Care Board Chairman Owen Foster on how they arrived at their decisions. Owen Foster, welcome back.
Good morning, Stuart. How are you?
Great. Thank you for coming back in. Days after the Green Mountain Care Board issued its hospital budget decisions for all 14, some are not happy. And I wanted to have you explain sort of the big disparities, and we'll put some of them on the screen. The big hospital in Burlington asked for 10%. You gave them 3.1. Copley asked for 15. You gave them about half that. But Rutland asked for 5.6 and got 5.6. Why the disparity?
Well, we take each submission based on what they provide us, and we evaluate them based on their ability to support the request. Some hospitals hit our guidance number. Rutland hit our guidance number, and so their submission is more likely to be approved because they were within that guidance range of 8.6 over 2 years for the NPR growth. Other hospitals were quite a bit above it. I think the UVM hospitals were over 20% as opposed to 8.6.
Over 2 years.
Correct. Right.
Yeah. Now, they, I'm sure, have explanations for why they're so far over, and you take that into account.
We do. Right. We look at all the information that's provided to us, and then we look at our statutory factors and evaluate how that submission lines up with the goals and mission of the Care Board and what we're trying to do as a state in terms of affordability, access, and quality.
Hospitals that are unhappy can appeal?
They can appeal. I think they can first move for a motion to reconsider the decision, and then later, after they get the written orders, they can appeal.
Have any done so far?
To my knowledge, not yet.
All right, but their fiscal year begins in just a few days.
Correct.
On October 1st. In UVM's case, one of your board members, Tom Walsh, made an interesting comment that was quoted, I think, in VT Digger. He said that since the formation of the UVM Health Network, a compilation of 6 hospitals in our region and 3 in Vermont, it's resulted in a management that is trying to grow, particularly in Burlington, and you've seen no efficiency, no cost savings so far. Is that fair to say?
That's something we asked about in the budget process. Some of the theory behind consolidation is that it'll achieve economies of scale and make prices go down. So that was an area of inquiry in the budget process, whether or not those investments have pulled through to save Vermonters money.
So is that of concern? Is that something that you can and try to force?
It's an area that we look at in evaluating whether or not we should give the kind of rate increases that they're looking for. When I looked at it, it looked as though there's still opportunity for those efficiencies to be realized.
UVM is also in a dispute with its support staff. The union is pressing for significant pay increases, as we've seen with other employees at the hospital. What message does the haircut you've given the Burlington Medical Center telegraph to management? What should they do?
We didn't give a haircut. We increased the NPR by the amount they requested, and then we increased the rate that they can charge insurance companies over last year. It was a 3.1% increase over last year in rate and a 20+% NPR growth over 2 years. In terms of the staffing, we think the staffing should be paid adequately and appropriately with the market. And in making those investments, I think helps drive down some of the traveler costs that we've been seeing the last few years.
Can you explain, as you alluded to, the difference between allowing net patient revenue to grow and allowing rates to grow? And those are two different things.
Right. So net patient revenue, the amount of revenue a hospital can bring in from serving patients, can be impacted by a number of things. How many patients you see, what services you provide those patients, Medicare payments, Medicaid payments, commercial payments. And so we allowed, I think, 10 of the 14 hospitals to get the exact amount of revenue they had asked for. So they can grow their budgets by that amount. In the case of the network, it was over 20%. And then the next component is how much more can they charge commercial payers for those services. And I think system-wide, we approved a 4.1% increase. And what we're trying to do is balance the need for access with people's ability to pay for it, because people's ability to pay for healthcare is getting more and more strained as these rate increases go up. You alluded to the disparity in the amounts of rate that the Care Board granted. And what you see is really a 2-year guidance period. And so we evaluated the requests in light of what they received last year and in light of the strength of the submission they provided this year.
So in Burlington's case, was the fact that UVM got a almost 15% bump last year in rates, did that lead directly to its relatively modest 3% rate hike this year?
Yeah, the rate hike that UVM got this year was based on an inflationary factor. It was related to that and related to how well they supported their submission that they provided us.
Ahead of your deliberation, some of the trustees at the Health Network sent legislative leaders a letter. And I understand you were aware of it and got a copy. And it said that the hospitals have what they say were, quote, grave concerns with the current regulatory system governing health care in our state. That was seen as a unusual, maybe aggressive step, just as you were about to issue your decisions. What'd you think?
I received a copy of the letter, and I thought it really reflected the challenges that our healthcare system has. Hospitals are concerned, their boards are concerned, community providers are concerned, mental health providers are concerned, and payers are concerned. Vermont costs for healthcare are going up significantly every single year. And meanwhile, we're seeing hospital finances do very poorly, as well as our community providers really operating on a razor's edge. So I think that letter really reflected the challenges that we all are feeling and experiencing.
But they were going after the board as well.
They had concerns with what they thought was the process.
Is there something wrong with the process?
We're always trying to improve our process. This year was the first year of a revamp of our hospital budget process where we tried to become more data-driven, having national benchmarks and really looking at hospitals' ability to contain expense growth. So you talked a little bit about the disparity in the rate increases. I think the rate increases went from 1.5 up to 8%. And some of that was based on hospitals' ability to control expense growth. So we want to invest in hospitals that are doing really well, high quality, high access, without having high expense growth. And so that's really something that's important to us to look at.
Assuming that, let's just stipulate that the orders that were issued a few days ago by the board stand, what is likely to happen to commercial health insurance rates next year as a consequence of this year's review?
Yeah, the hope and goal is that they do not increase as much as we've seen the last couple of years. This last year, it was 13, 14% increase to ratepayers. That's really high. And when you see rate increases go up, you see people buy lower levels of insurance, or you see the underinsured rate increase, or people have greater medical debt. We don't want that. People need to afford the care that they need. And so we're trying to balance the sustainability of hospital finances with people's ability to pay those rates. So over 2 years, we're seeing over 20% increase in rates for Vermonters, and that's really high. You want that number to be relatively consistent with wage growth so that people can afford the care.
Yeah. The budget decisions have nothing to do with some of the pending big ticket capital items that require what's called a certificate of need in our state. You have those still pending, including the big surgical center that UVM has asked for in South Burlington.
That's right, that's still pending.
And is there any relationship between some of the budget decisions you're making and the likelihood that you would look favorably on a, $100+ million facility?
I don't think that they're directly related. I mean, they're each their own submissions that we evaluate based on what's before us.
When will that come?
I don't know the exact timing. There's a series of questions and how long it takes to get answers back. That process is ongoing.
And what about the broader conversation? When you were last here, you alluded to a process, a community process that will begin later this year to try to right size or align healthcare in Vermont with Vermonters' ability to afford it.
Right, so the Act 167 work is getting underway, and that is a community engagement process to learn about what services different communities have and don't have that they need. We know there's a shortage of primary care in Vermont. We know there's a shortage of long-term care. We know there's a shortage of mental health care. So we're trying to look at ways to ensure that communities have what they need, and that where there's overlap of infrastructure and overhead that is not necessary to provide communities the care they need, that we can take a look at that and local boards can make decisions for their communities.
And that will begin?
It's already underway.
It is?
It is.
We look forward to hearing more. Owen Foster, the chair of Vermont's Green Mountain Care Board. Thanks for coming in.
Thank you for having me.
Now, just after that interview, UVM Medical Center struck a tentative agreement for a new contract involving its 2,400 unionized service, maintenance, clinical, and technical staff. Terms were not disclosed. We'll get the hospital's perspective on all of this when we come back. The Green Mountain Care Board is clearly alarmed by the inability of some hospitals to control their expense growth, raising medical costs for all of us. And they are worried some smaller hospitals are trying to do too much at too high a cost. As the board opened its review, they heard from the state's consumer watchdog.
The concerns from the hospitals of what happens if they can't provide the care already exists for Vermonters who are making the choice of who are dealing on the ground today with how do I get the care I need or my loved one needs and be able to afford the out-of-pocket costs.
So, did regulators in the end strike the right balance in their budget decisions? Here's another view. Mike Del Trecco, welcome to NBC5.
Thank you.
Thanks for coming in. You're president of the Association of Hospitals and Health Systems. That means you represent all 14 hospitals in the state?
That's correct.
At the outset of the annual budget review process, you asked the Green Mountain Care Board, the state's healthcare regulator, please approve these budgets as presented. They didn't take your advice. The decisions out a week ago saw the board took a haircut to about half of your members, and yet others were approved, were given exactly what they wanted. And I'm wondering, does that make sense to you?
Well, I think, in healthcare in this moment, I'll call it a pivotal moment. Many have moved on from the pandemic. Our hospitals haven't. We were faced with many pressures around inflation. Workforce is primarily our major challenge, and the work isn't static. So we've had to go out and recruit a lot of travelers, they're called, or contract labor to fill some of the vacancies in our organizations to take and deliver that care. So when you add those pressures, and it's not really a static moment, we need support and resources for those budgets.
In other words, travelers exploded your budgets.
Correct.
Because a traveler nurse is paid, what, 2-3 times what a
correct
a full-time permanent nurse is?
That's correct.
All right. So last year, a number of your members received really big increases. I'm thinking UVM Medical Center, the big kahuna, was almost 15%. Are those cost pressures still with us a year later?
Right. So part of the reason why we did indeed ask for those hospitals to be approved, when we build our budgets, they're built on patient need. If there are efficiencies to be had, we should capture those savings. Couldn't agree more about that. But that's how we build our budgets. What's the patient demand? What are the resources we need to take care of those patients? And then we build our budgets around that information. And when we look at the end result, we want to have some monies to reinvest in our organization. You know, one incredible thing is that we're all not-for-profit organizations. And that's not always understood completely, but what it allows us to do is take all of our money and reinvest them back into our organizations, which is our people, which is technology, which is delivering care. Sometimes it's life-saving care, sometimes it's babies. We're bringing people into the world. So that's how we build our budgets and establish the base. What are our needs to deliver this care?
Across the state, system-wide, the board analysts say that your members asked for 10.6% more system-wide. They approved 4.1. Mm-hmm. That's a haircut. Now, within, as we said, individual hospitals, and you're not here to defend individual hospitals, I know, but UVM asked for 10, got 3.1. Copley asked for 15, got 8. CVMC asked for 10, got 5. Mm-hmm. But Rutland asked for 5.6 and got 5.6. Mm-hmm. What's going on?
Yeah, so I think, you know, I'll just key in again and say we're asking for what we need. And, you know, there's a lot of uncertainty in this budget process that I think we need to work towards cleaning up and collaborate and work with the regulator and the process within that regulation structure so our hospitals can have some certainty as we move forward and predict more than 1 year at a time. You know, this budget cycle took about 8 months. And the decisions are made on 9/15. Budget orders will happen on 10/1. That's the start of our fiscal year, by the way, 10/1. So we have about 15 days to manage some of these changes and adjustments. And some of them, as you pointed out, are fairly large, and the organizations are trying to evaluate what do the orders mean, how does it affect business, and how do we be transparent to our communities and to the regulator on what these implications are.
Well, how are your members going to have to respond? I mean, you used to be the CFO, you know numbers. Mm-hmm. What's going to have to happen? Yeah,
so we'll start to evaluate some of that information and look at how does that contract labor? What are the supporting things? I can tell you from my position today, the one very significant thing I'm concerned about is the ripple effect at the health network. They are our tertiary center of Vermont. All of our Vermont hospitals rely on that organization to take patients with high acuity, heart attack cases, things of that nature, and care for those people. If access is restricted in any way, that will be a problem for the entire state of Vermont and the delivery system. So that's one thing that I am carefully watching.
The UVM Health Network.
Correct.
Those 3 Vermont hospitals, but you're primarily focused on Burlington.
The tertiary center is, you know, a supporting organization of all of our other rural and community hospitals for that tertiary care.
On the flip side, someone has to pay this bill. Mm-hmm. What do you say to Vermonters who are going to open up their health insurance premium in January and turn white?
Mm-hmm. So I'd start by saying that, you know, affordability is clearly on our mind. And it's not something we take lightly. And actually, we lean in Vermont. We are a really progressive state when it comes to healthcare reform, early adopter to this value-based model. Moving in the future, we're talking about global budgets, and that's how we're addressing some of these concerns. I wanted to demystify some of this rate increase number a little bit here. When a hospital is asking for 10%, that does not mean a 10% premium increase. That means their charge structure, and then there's a negotiation process with commercial insurers. Medicaid and Medicare pay what they pay. There's no negotiation in that contractual phase. So, you know, just for your viewers and listeners, that's not a direct one-for-one increase to premiums.
Well, but to your point, Medicare and Medicaid pay what they pay, and what they don't pay has historically been shifted over to commercial insurance rates that working people tend to get through their employers.
Yeah, we work hard to in that budget process and with the regulator, and those increases are caps. They're not floors on increases. So That's not a complete shift. We actually do a lot of internal work to save money. When you look at our Medicare per beneficiary expenses compared to the nation, we are lower. There's a lot of wonderful things in Vermont that are happening around this affordability. 98% of Vermonters have insurance. It may not be the best insurance and there may be some high copays and deductibles attached to that, but 98% have insurance. And what that means is medical debt is lower, and we work with our patients day in and day out to make sure that they not only receive the care that they need, but also if they're eligible for free care, we want to make them work through that process, and then finally, if they're eligible for Medicaid, we help them with that enrollment process as well.
You mentioned your concern about the UVM Health Network going forward. Were you aware that trustees sent legislative leaders a letter in the days leading up to the budget decision saying that they, quote, have grave concerns about the current regulatory system governing healthcare in our state?
I read that letter, yes.
Those are strong words. Is the Green Mountain Care Board regulatory process broken? Does it need to be?
I think I would key in on the uncertainty that the process creates. Our process started back in March. We had a lot of dialogue with the regulator, and make no mistake, that's a hard job. They have a really difficult job evaluating our organizations, trying to balance affordability and access, because there's no conversation around affordability that the word access and quality this is not a one-dimensional conversation. So they have a hard job. I would lean in and say there's too much uncertainty. We appreciate the direction of the measurement and how they're going about their business, but we need a little bit more clarity. We need a little bit more work on the front end to make this process a little less chaotic.
Are any of your members at risk of not being able to continue?
Nationwide in the last 10 years, we've had about 136 hospitals closed. And around the country in rural areas, there's about 30% that are at risk. I think when you look at some of the financial performance in Vermont, in 2022, 9 of our 14 hospitals were operating losses. Problematic is particularly when you move into fiscal year 23 and some of the inflationary pressures and challenges still remain. But no, I don't believe any organization is immediate jeopardy.
Mike Del Trecco, CEO and President of the Association of Hospitals, thanks for being with us.
Thank you.